Good morning, good afternoon, or good evening, everyone, wherever you are around the world. My name is Jason Byrne, and today we'll be delivering you the AiRISTA hand hygiene compliance monitoring solution, and how to deal with the issues and meet the standards and engage your staff around this particular challenge in the healthcare industry. The agenda today, we'll be talking a little bit about in technology and where we've come from over the last several years around this technology. The introduction and the life cycle of AiRISTA Flow over the last several years, the hand hygiene compliance scenario and all aspects of it. Then we'll be moving into how can we improve the response and the compliance and the standards in the industry. Then we'll move into the UVS overview, which is the AiRISTA Flow Universal Visibility Solution, which will give us some aspects around how we can implement a compliant hand hygiene solution. Then we'll look into some popular use cases in healthcare, specifically using the AiRISTA Flow solution. And then lastly, we'll have Q&A at the end. We expect this to run for about 30 to 35 minutes. At the bottom of your screen, you should see a little Q&A box. If there's any questions that you have, please enter them here and we'll address them at the end of the webinar sections. So a little bit about In Technology. In Technology was founded in 1999 in Perth. And for those of you that are good at maths, that'll add up to you for this is our 20th year of operation. So it's a long time and a very big milestone in business. We have offices headquartered on the Gold Coast with Sydney and Melbourne, as well as our headquarters of Southeast Asia in Manila, Philippines. Across those offices, we have approximately 33 staff in those locations. And given what we've done over the last more than 50% of the years of operation, we've been spending a lot of time in the wireless, specifically the Wi-Fi space, and seen that technology rise and become more critical in environments, specifically in healthcare. We've emphasised a big focus into the RTLS industry, real-time location services, as well as new technologies such as BLE, wayfinding, and such things like surgical scanning, and using those technology within the healthcare industry. The benefit that you have with dealing with In Technology is that we're not just about selling products, we're about the value-added distribution partner. We are one of the last remaining VADs in the industry, and we do offer you that value add by looking at some of the services that we've been able to provide our partners and our end users and their end users over the years. And these, some of these are written on the board here. I'm not going to read them all to you, but things like predictive and post-development Wi-Fi services, surveys, implementation and validation, installation and configuration, and helping you answer those tenders that come out that you might not have the experience around. And that's where the real benefit of dealing with In Technology has been and will continue to be over the years to come. Right now, I'd like to introduce you to Armin Vardanian, our Chief Technical Officer of In Technology Distribution, who will be running through today's presentation. So I'll hand over to you now, Armin.
Thank you very much, Jason. So a little bit about AiRISTA Flow, who's the vendor that we'll be talking about today, primarily around how to solve the hand hygiene problem, at least, if not solve, then at least manage our response to it. So AiRISTA Flow has got a lot of experience in a lot of different marketplaces, including healthcare, with a strong presence there, as well as with aerospace, oil and gas, and various other markets like that, as well as manufacturing as well. This marketplace experience has given AiRISTA Flow a lot of technical expertise around implementing workflows effectively that involve both semi-passive GPS, RFID, BLE, and Wi-Fi based technologies, and building solutions and workflows around those technologies. AiRISTA has got a lot of experience, and we've brought on board the experience from a company of the assets of Ekahau around RTLS, happened in 2017, and we're looking at a major release of UVS, which is the main platform AiRISTA has for location services, where we are integrating the workflows provided by the assets acquired and building a fully holistic single platform for all our existing and new clients in the marketplace. AiRISTA is very well recognized by companies, including Gartner, as you can see here on the Gartner Magic Quadrant for indoor location services. When we talk about indoor location services, some people call it RTLS, real-time location, or indoor positioning systems. Now you notice here that AiRISTA has been identified by Gartner as being a leading challenger in the indoor location space. Now, it's interesting here that part of the reason this is the case, we've had that recognition, is because we're vendor neutral in the sense that we can work with any Wi-Fi network and work with many other manufacturers and systems to deliver a single platform to build on very intricate and very usable workflows. And one of those workflows we'll be talking about today is hand hygiene. Hand hygiene in healthcare is a serious health issue in the sense that the failure to comply with good hand hygiene policies, and we often talk about the 5 points of contact in many healthcare scenarios, the failure to comply with those 5 points of contact can cause serious side effects in terms of the outcomes on patient care. Now, complying with hand hygiene guidelines is a challenge. It's going to be a challenge that's not only going to be solved by technology, but certainly comes down to managing and interacting with human behavior. Because monitoring hand hygiene compliance is time consuming. Having to wash your hands 5 times every time you see a patient can get laborious, can get tedious, and the nature of human capacity for understanding, I guess I should say, is that it can be easy to just skip one and say, yeah, it's okay. And ideally, staff are supposed to be disinfecting after lots of different elements. So contacting bodily fluids, before patient contact, after patient contact, and after removing gloves, and all these different interactions. The reason being is that by not doing so, we increase the risk of infection. Part of the challenge with hand hygiene is managing compliance in terms of being aware of what's actually going on. We don't have little robots over our shoulders telling us to wash our hands, at least not at the moment, not in today's world. And we might see when drone technology starts to pop up, whether that's going to be an issue or not. But now at the moment, the biggest challenge we see is that just reporting and analysing effort is very, very manual. We talk about shadowing staff. And the nature of the shadowing process is when you do have an actual person watching you, funnily enough, compliance goes up. But what happens when that person actually has to go and run their reports and walk away? Well, what we find in practice is compliance starts to go down incrementally. And the challenge we get is that compliance failures are still quite prevalent. Some cases it's inadequate workflows around how staff are being trained, what staff are being expected to do. Other cases it's just a matter of forgetfulness and distraction. That's human nature. It's something that's natural, and we have to plan into any kind of solution. But also frequent room entries and exits. When someone is delivering medication or forgets something and has to go back, they have to remember to follow those guidelines around hand hygiene. Also, data being infrequently collected and reported. Well, if you're only checking every 3 months or every 6 months, but you've got new staff that have come on board within those 6 months, then you have no way to verify whether those new staff are being as compliant as the old ones. There's also scenarios which are unavoidable. Emergency situations, all those codes that come in, when you've got a nurse running to save a patient, often the last thing on their mind is, oh, wait, let me just stop for the defibrillator to wash my hands. That's not how nurses think. Nurses are very focused on patient care, and they will do whatever it takes to keep a patient alive. And so, unfortunately, there will always be circumstances where they can't be as compliant as they need to be. Other social elements which can introduce compliance failures are the lack of reminders. So when you've got 2 people standing in front of a basin, one of them washes and the other one doesn't, the odds of the person who doesn't getting reprimanded or being at least commented on are pretty slim. Obviously, the healthcare environment is just a social environment just like any other workplace. So the need to obviously avoid too much peer pressure can cause compliance failures as well by that nature. And lastly, when you have inadequate safety culture that doesn't emphasize compliance, when you're talking about situations where managers aren't reinforcing. Now, many healthcare environments I see in Australia and across the Asia Pacific do have things like posters and guidelines and meetings around healthcare compliance. But fundamentally, if your organization doesn't put hand hygiene compliance front and center, it will end up getting pushed down the list of priorities that staff have, usually preferencing other elements of patient care. So how do we solve or how do we manage this problem? Now, fundamentally, we can't change human nature. What we can do is create an environment which encourages good compliance and avoids a lot of the pitfalls that manual compliance measures actually have. Now, an automated hand hygiene compliance solution, you can see on the example in the screenshot there, or the picture there, I should say, is be able to automatically track when someone actually uses the dispenser, which is that key source of infection control. So be able to reliably capture hand hygiene events, be able to target feedback. So how do you capture that? We'll talk about that in a moment when we'll go through how this actually builds out. Be able to integrate seamlessly, be able to notify staff rather than having an annoying person go, have you washed your hands yet? But politely instructing someone saying, hey, just with a simple text alert saying, hey, you might need to wash your hands, or don't forget to wash your hands. A simple reminder is often something that people just need in order to maintain compliance, is an awareness, and that self-awareness as well, which can be trained and educated to staff. Now, the key thing here is the feasibility. So being able to have battery power technology with today's lithium ion base, you can actually retrofit a lot of solutions around hand hygiene and implement that into existing facilities without a lot of overhead. Now, what automation brings is extensive reporting capabilities, and we'll talk about that as well. So when you talk about avoiding the need to have to shadow people, by being able to document all that stuff automatically, you can save a lot of manpower and get much more accurate reporting on the levels of compliance for healthcare workers, units, or hospital levels. Now, what happens if we're non-compliant? What's the risk here that we're trying to address? Well, on a daily basis, some of the stats we've got in Australia at least, one in every 25 patients in a healthcare facility has what's considered a healthcare associated infection. Another issue is cost related. So we're talking about not just the cost of compliance, but the cost of resolving infections and other transferable and avoidable infection issues. So contagious diseases and whatnot, having to deal with the extra healthcare costs can place a significant burden on a healthcare facility. You're also talking about direct manual observation and be able to the issue of having to spend a lot of manpower and cost associated with that in terms of being able to track hand hygiene compliance. Now, just to give you some context of the scope of the problem, on average about 39% compliance rates are what we often see. And I spoke with one healthcare worker who was part of their infection control team, and they were saying, oh, we're at 60% and we're actually on the higher levels within the facility. And that's based on manual monitoring and the self-correction that I talked about before. In reality, it's likely that we're overestimating the level of compliance rather than underestimating. Now, the extensive reporting and those kinds of elements means there's lots of time required to manage the process of hand hygiene compliance. The reporting burden is very high, and we see a lot of infection control teams that spend a lot of their time behind desks rather than in the environment in order to process all the data, which may not even be accurate. So how does the solution work? So let's talk about what bits we need. But obviously, the key thing with hand hygiene is washing your hands. So in order to wash your hands, you need some soap. So the key thing here is how do we define whether soap's been used? And that's where we attach or we link with a hygiene detection unit, hygiene dispenser unit, where we have a trigger-based Bluetooth signal. So it only signals when someone actually uses it, which avoids a lot of the problems that we get with proximity-based solutions, where if someone just walks past, that's not good enough. They actually have to interact with the soap. Now, well, how do we detect who's actually washed their hands? Well, that's with the AiRISTA badge tag, which any of the BLE tags that are used for staff mechanisms, whether it's the B4 or the T5, you'll see a picture of the B4 later down the track. We're just seeing the picture as the T5. And you can see that has a BLE receiver in it. So it knows, well, this is the person that was here when this dispenser was triggered. And there are ways of managing proximity-based detection when you've got two people near a sink. You can actually either attribute it to both or have your own business logic for that. In addition to that, you've also got BLE-related location, which you can also leverage your Wi-Fi network for as well, around identifying whether someone's come in contact with a patient. And so those three elements allow you to capture a lot of all the hand hygiene opportunities. Be able to use battery technology means that you don't have to worry about adding additional wires to your infrastructure, which can be significantly a significant cost burden to implement. And you can integrate those with staff systems as well, with third-party systems, with HL7 and other patient care plans. So you know, for example, like you can identify which staff member has interacted with a patient. So if there is an infection control issue, you can actually replay those events and look at exactly who touched what and where. So in the patient area, so you might have a healthcare worker using a dispenser prior to entering the area. So the zoning is quite a powerful part of the location services. You can see how UBS's location platform is critical to delivering an effective hand hygiene automation solution. For the healthcare worker, that's what HCW stands for. So their badge monitors where they are, how close they get, whether they've actually interacted with a hygiene dispensing unit, and all these elements can be logged with location as well, so that we know which one was used, where it was used, when it was used, and in which order and sequence. So the strength of that is that it requires minimal interaction by the staff member in order to do the tracking. All they have to do is wash their hands. So you can see very clearly that with hand hygiene automation, there's a lot of overhead that just disappears. So the patient area here obviously is bedrooms, wards. If you're dealing with a situation where you have 2 patients in a room, which is still quite prevalent in current modern hospitals, then with BLE, you can actually have bed level accuracy. So you can identify whether a staff member has interacted with one patient and whether they wash their hands between the other, moving to the other one in the same room. So although this picture shows you one room for one location, that isn't necessarily a requirement. You can actually have multiple zones within a room with BLE. So there's lots of different benefits towards having an automated hand hygiene solution. You've got definable parameters. Obviously, most people will follow the 5 points of hygiene, but in certain scenarios, if you're talking about acute care versus rehabilitation versus infection control, where you have to have very strict procedures and making sure that you want to have preventative notifications, or at least corrective notifications to avoid the problem when you know it's a high risk. All these parameters can be defined. And I see with many hospitals making sure that rooms have been cleaned when an infectious patient has been in there, or making sure that where an infectious patient has been moved around, the procedures are followed wherever they go. And that kind of location-based rules can be implemented with the UBS solution. It's fully wireless, which means it's very easy to deploy. The main element of integration is the hygiene dispensing units, but badge tags are something that staff are very comfortable with wearing, and BLE and battery-powered BLE units are very easy to install. And it's easy to identify the problem areas. When you have that analytics and that automation, you can start to feed that back into your training to try and get much higher results, and obviously identify those unfortunately non-compliant healthcare workers who refuse to wash their hands. Now, as a male, I know I'm always a bit concerned about people who go to the bathroom and don't wash their hands. As much as we want to say something, we don't. In this solution, we don't have to. The solution automatically tracks those and allows us to identify them and remediate them as we see. So the UBS solution provides on a software level features and guidance for behavioural change. It's not just a technical solution. It's also about guiding the social education of healthcare workers. And to do that, we've got extensive data mining and reporting capabilities. And obviously we can leverage that existing Wi-Fi infrastructure for a lot of the communication there as well, which means that if you have the same solution that built on UBS for asset tracking or staff safety or patient care, it's very easy to layer on a solution for hand hygiene. And we're able to retrofit many dispensing unit equipment types. This is an example of the staff compliance report. So obviously, this is a very easy to understand report. I'm not sure if the resolution might be a bit high for you, but certainly what this demonstrates is a simplicity of the software solution. The biggest challenge we have is the reporting, the overhead and reporting. But automating all the data collection process, we're also able to automate the report generation, which means we can actually get real-time and much closer periodic reports. Rather than having to wait 3 months for a shadowing survey to complete and be processed, we can get up-to-date live information, not just for a single department, but for individual healthcare workers or departments, depending on the levels of privacy you want to maintain, or even up to a whole hospital. So if you have overall reporting obligations to make regarding larger healthcare institutions, you can implement them very easily with UBS. And there's lots of interactive dashboards. You can chop and change the data. You can look at maps. You can analyze trends. You can identify whether there are issues in terms of particular particular wash stations that are underutilized, for example, or that are overutilized. Issues of cross-infection can be analysed. There's lots of different reports you can make, and you can customise them to meet your needs, the needs of your organisation. So that customisation falls into ad hoc reporting. If there's particular bits of information, there's drill down. You can have compliance by hospital and unit, compliance by employee, by role type. So you can have a leaderboard on doctors versus nurses if you wanted to, or wardsmen. You can have compliance by location as well. And that location extends beyond just the single facility. You can have whole health districts be covered under your health compliance reporting. Now, the client support and training. So obviously you've got behavioral change and those kind of elements, and that's something that the AiRISTA technology can leverage. When you're talking about, okay, what do we actually have to do to implement this effectively? Had to get a stakeholder buy-in, for example. Obviously, making sure that people wear their badges, making sure that you have compliance in that part, facilitates the process of hand hygiene as well. Now, the combination of being able to use a B4 tag with BLE means that you can use the same tags that you're using for duress, which most staff, healthcare workers are quite happy to wear, and also use it for hand hygiene compliance. Again, increasing your uptake, increasing your